I'm making a difference.
I am making a difference.
J'agis pour un monde
I am
meilleur.
making a difference.
I am making a difference.
I am making a difference.
I'm making a difference.
I am making a difference.
I am making a difference.
My name's Megan Wilton, and I'm a practicing midwife in Winnipeg, and I'm a member of the Midwives Association of Manitoba. I'm making a difference by working towards Millennium Goal number 5, improve maternal health. Midwives in Manitoba, the same as midwives around the world, are providing prenatal care, care during labor and birth, and postpartum care, including breastfeeding support, to women who are having healthy pregnancies and birth. We also provide referrals to specialist care. I had the opportunity to travel to Tanzania as a student midwife. It was an elective placement as part of my midwifery degree, and I got to work alongside other student midwives from Tanzania in the prenatal clinic as well as in the regional hospital. As a student working with other student midwives, it was really striking the similarities. We were learning the same things. We even had the same midwifery textbook, and we were providing the same sorts of lab tests in the prenatal period and the same sort of tests, checking on people's blood pressure, checking on the growth of the fetus, and the same sort of care during labor and birth, right? Monitoring the progress of labor and preventing postpartum hemorrhage after the birth. Women in Tanzania and Manitoba can face some of the same challenges in accessing care. For women who are poor, moving into get their prenatal care and moving to get their postpartum care can be a challenge. They're moving from rural and remote areas in Manitoba and Tanzania can be a challenge, but obviously those are greater challenges for more people in Tanzania than they are in Manitoba. In terms of the care at the hospital and the prenatal clinic, certainly resources are a lot tighter in Tanzania. I recall in particular one woman who needed to be transferred to another hospital for a cesarean delivery because they had run out of anesthetic gas in the operating room. So although all the people were there on staff necessarily to do the operation, there would have been a delay in that person's care to move to another facility just because of a shortage of medication. Improving maternal health is for every woman in the world. When I was a youth intern in Tanzania, I got to know a young woman named Josephina. She was one of our youth workers, and she was a very bright, interesting person to spend time with. She's also a great success story of the Craft Micro Enterprise project. She and her friend had taken a business of weaving some pot holders and had turned that into, taken their profits and bought a sewing machine and had turned that into a very profitable business in Tanzania. 2 years ago, Josephina died in childbirth. And you can imagine the loss to her family, her best friend and business partner, but also to the bigger community, right? And it's an individual tragedy, but we know that there are thousands more women dying every day, and we know that those are preventable deaths. When we think of the Millennium Development Goals, we think that they're all interrelated, but there's no more obvious connection than between maternal and child health. There's a direct relationship between the maternal health during pregnancy and birth and the health of the child immediately after birth. There's also an indirect relationship between the maternal health and the health of the children at home. So every woman that dies during pregnancy and birth and leaves young children at home, those children's health is deeply impacted. They have much higher likelihood of dying of childhood diseases, much higher likelihood of being malnourished. Having a skilled attendant at a birth makes the difference between life and death. Having proper nutrition, being relieved from poverty makes the difference between life and death. Having proper prenatal care, it makes the difference between life and death. Those are basic rights that we take for granted here in the developed world, but I think they should be extended to everyone in the world. My name is Megan Wilton, and I'm making a difference.